Immunization dates and types is the next lecture. As you know, immunizations, also called vaccines, are those little doses of big, dangerous viruses. It helps the body to develop early immunity so that the body can form a defense system early in age. This is the main reason immunizations are given to children, as the primary means of protecting the body against deadly communicable diseases, like polio, hepatitis, pneumonia, varicella, MMR, among others. So ATI mentions communicable diseases, the best primary prevention strategy, obtaining scheduled immunizations. Now, before we get into all the memory tricks for the vaccination dates and age ranges, let's cover some top tested key points. So be sure to write this down. We never give live vaccines to those who have a low immune system. This will actually kill the client. So just think, no on the low, no live vaccines for low immune system clients. So write down this list here. The live vaccines include varicella zoster, big NCLEX tip there, influenza, also called the flu shot, MMR, including measles, mumps, rubella, as well as rotavirus. And for low immune system clients that are commonly tested, clients who have cancer, specifically leukemia and lymphoma, this was top tested, so be sure to write that one down. And clients undergoing chemotherapy and radiation, as well as clients on immunosuppressants like methotrexate, and even IVIG, immunoglobulin therapy. And as a big side note here, pregnant clients too. They don't necessarily have a low immune system, but we don't give any live vaccines. So don't let the NCLEX trick you here. Pneumonia vaccine is not a live vaccine, and neither is the hepatitis vaccine. So a top missed NCLEX question here. The nurse should clarify with the provider before administering which vaccination. Varicella zoster vaccine for a client recently diagnosed with leukemia. Yes, no live vaccines to the low immune system clients. And Saunders mentions a child receiving long-term immunosuppressive therapy. Which vaccine is contraindicated? MMR. And Hesse, contraindicated for children who are immunocompromised. Select all that apply. Varicella and MMR, the measles, mumps, and rubella. So please be sure to know no live vaccines for the low immunocompromised patients. Now, switching gears to reactions after vaccinations. Some common to be expected reactions is a mild fever. Be sure to write that one down. Huge NCLEX tip. As well as redness and swelling at the injection site. We always apply a cold pack to the site. And lastly, a little side note here. If the client has a common cold or even a minor illness, well, yes, we still give the vaccine. A big test tip right there. Many students did not want to give the vaccine, but we still give it for a common cold and a minor illness. Now, some severe reactions that are not expected. Be sure to write this down. A fever above 102 Fahrenheit or 38.9 Celsius. Big NCLEX tip. As well as febrile seizures. We're talking fevers so high that the little baby can go into convulsions. So please be sure to write that down. The key number again is 102 Fahrenheit. This is not to be expected and is considered a very severe reaction. So if you get a question about parents calling in about a high temperature, well, ask the parents calling in, what is your child's temperature right now? And administer acetaminophen, brand name Tylenol. Again, a big test tip is we do not give routine vaccinations to any child with a severe fever, but we can give it to clients with a common cold. So once again, the key term here is a severe fever over 102. So ATI mentions a 6-month-old infant scheduled for routine immunizations with a fever of 103. The nurse's best response is to advise the parents to have the child seen by the pediatrician, but the immunizations will need to be postponed until the baby is well. Yes, the key number again here is 103, way above 102. And Saunders had a question. The student should question whether to administer immunizations to a child with which condition? A severe febrile illness. The key term there is severe. And Hesse, varicella, and measles, mumps, and rubella, MMR vaccines. Children can be vaccinated when they have the common cold. Yes, once again, the key term here is common cold. We still give the vaccines, but we avoid it with severe febrile illnesses. Now, switching gears to allergies and adverse effects with immunizations. So first up is influenza, the flu shot. Clients might have a reaction if they have an allergic reaction to eggs, as mentioned by Hesse. And for MMR, if they have a prior allergic reaction to neomycin, the antibiotic, as mentioned by Hesse. And an adverse effect is arthritis, talked about by Kaplan. And for the Hep B, the hepatitis B vaccine, prior anaphylactic reaction to yeast, as mentioned by ATI. And for the last one here, IVP, the polio vaccine, prior anaphylactic reaction to neomycin, once again, the antibiotic, as mentioned by Saunders. So as you can see, neomycin, the antibiotic, was a huge problem here. Any client who has an allergic reaction to neomycin will probably have a reaction to the MMR and polio vaccine. Okay, now that we've covered these key points, let's get into the memorization tricks. Now there's two ways to memorize it, either by immunizations itself, which we'll cover first, and the second is by the age of the child, which I personally believe is the best way to memorize it. Now we're going to cover that one second. And don't worry, I'm going to make sure to highlight the most tested dates just so that you don't feel overwhelmed. Okay, starting with immunization list itself. So first up is the Hep B, or hepatitis B vaccine. So be sure to write this down. The age of the child is at 0, 2, and 6 months old. And ATI mentions we have a window between 6 to 18 months. So Hesse mentions a 12-year-old child has not received the hepatitis B vaccine. The 3-dose series would be started at this time. Now for RV, the rotavirus, that's given at 2, 4, and 6 months. And polio, or the IPV, is given at 2, 4, 6 months, as well as 4 to 6 years. Next is the pneumococcal vaccine, the PCV, or basically just the pneumonia vaccine. That one's given at 2, 4, 6, and 12 months. Next is the HIB, as in boy, vaccine. So not HIV, but HIB. This one is also given at 2, 4, 6, and 12. Next is DTaP. This one is also given at 2, 4, 6, and 12, and 4 to 6 years. Now, please be sure to write this one down. This one is top tested because it's given so frequently. So Kaplan mentions 6-month-old infant at 2 months of age received the first DTaP. Which action by the nurse is most appropriate? Give the second DTaP. Now, next is influenza, or basically the flu shot. It begins at 6 months, and it's given annually as a flu shot thereafter. Next is MMR, the measles, mumps, and rubella. It's given at 1 and 4 years old, or really the age range here is 12 to 18 months and 4 to 6 years old. But really the most tested was 1 and 4 years. Next is the varicella, or VAR. That one is also given at 1 and 4 years. And